BMC N5 Mask User Guide. N5, an easy-fitting nasal mask, is able to provide more comfort. It is suitable for the patients who suffer from sleep apnea. The mask should be cleaned daily and replaced every 6 months. Please replace the mask immediately if any break occurs in order to ensure effective therapy. Choosing the mask. Measure the face with sizing gauge in order to choose an appropriate mask size accordingly. We note medium size is better. Preparing the mask. Open the package. Take out the mask, the headgear, and the user manual successively. Mask connection. Spread the headgear on the table as inverted triangle with the logo facing down. Put the upper ends of the headgear into the fitting hole and attach them well. Connect the unilateral clip below. A click means a correct fitting. Mask fitting. Push the mask slightly onto the nose. Pull the headgear over the head top. Put the other clip of the headgear into the fitting hole. The upper edge of the cushion should be aligned with the nose root, while the edge below with the subnasal point. Adjust the headgear by both sides simultaneously so that 1 or 2 fingers are able to slide smoothly. The video is displaying the correct way of fitting. Mask disassembly. Separate the clips from the mask. Release the headgear. Take off the clips and the cushion assembly successively. Clean them with running water directly or do it after immersion into the neutral detergent. Dry them in a cool place without direct sunlight. Mask reassembly. Insert the cushion assembly into the mainframe. Fit the headgear into the clips and attach them well. Fit the headgear finally. About the headgear assembly, please refer to the mask fitting guide.